first question. Next slide. Okay. Mayor Oka, sa inyo po ito. Paano po i-engage ang mga kabataan in climate change adaptation and mitigation strategies?
Well, ang key dyan is how do you get the young to be involved, no? Dahil climate change, madaling ibenta sa kanila yan. No? The difficult part is yung unang step, no? Siguro blessing din sa akin yung in my first term as mayor na the city council was totally uncooperative, no? Obstructive pa nga. So that led me to, that constrained me to go to the stakeholders in general, academe, interfaith, business sector, the youth, no? Nilapitan ko sila and nakiusap ako dahil walang budget that was approved during my first term, walang authority that was given, wala talagang cooperation in any way. They wanted me to fail. So if they could straitjacket me, they would, no? All the cases were filed against me. Kaya yun, sabi ko nga noon, if I will not be able to do what I had committed to do, I would rather resign. No, pero kaya lumaban ako, and itong Galing Pook project that won for the city yesterday. The title of the project is Health is Worth Fighting For. And sinasabi ko noon hindi ko isusuko. I will not submit. No, I will not surrender. Doon sa youth, ang challenge dyan is how do you get the youth to be involved in at least the same way as the SK? No, dahil siyempre doon sa SK kasi hindi mo maiwasan, may politika dyan. No? Although maraming mga outstanding SK officials dito ngayon sa city. But what I did was I allowed the non-SK to participate. In the beginning, there were frictions. Of course, turf issue, rivalry, pero ngayon sa awa ng Diyos, they're collaborating very well. SK Federation and the youth sector. Yung sa youth sector, kasama ng out of school, kasama ng in school, and marami silang mga I organized the Oro Youth Council and I established an office in City Hall, so Oro Youth Development Office. So challenging, difficult, but doable.
Salamat, Mayor Oka. Nindot na nga slogan, challenging, difficult, but doable.
Lagi.
Okay. Sige, next question, parang sa DOH ito. Sinagsama na po namin Engineer Anarna. I think the interest really is we appreciate the data that was provided by the USEC, no? Kaya lang ang interesana ay what about Mindanao? What's the spotlight on Mindanao in relation to COVID and climate change, no? At dinagdag ko na dito parang some of the details the group is interested in is ano na ba yung data ng vaccinated population ng Mindanao, no? Tsaka ano ba yung status of vaccine supply for Mindanao given na yung NCR++ yata yung napaprioritize for vaccination? And what measures are in place to improve vaccination, especially in rural areas, of which marami yan sa Mindanao. So, Engineer Anarna, please.
Hi, good morning, Ma'am, Mags, and maraming salamat for inviting us. Good morning also to all the participants. Napakarami pala. Yung question number 1, what is the situation about COVID and climate change in Mindanao? For the COVID kasi, the situation ay nagbabaris every day. Di ba? Alam naman natin yun. Napapanood natin sa news. Every day you have to, there's a plus on the COVID situation. So for the Mindanao area, I would suggest for the meantime na tingnan natin yung data from the Mindanao. We have the CHDs in Mindanao. Kasi may mga region, di ba? Region 9, 10, 11, 12, BARM, and Caraga. So nag-iiba-iba yung data nila in every region of the whole Mindanao. So for the Department of Health, we have the National Vaccination Operation Centers na nagmamanage din ng mga buong data. So if okay lang sa inyo, I could be relaying this question to our National Vaccination Operations Center for the official statement na hindi magagaling sa akin ngayon kasi sila talaga yung nagre-release nito, then i-release to later today, every day dun sa aming mga news nakalink. Pero keep tuned dun sa aming Healthy Pilipinas or Facebook, na official Facebook ng Department of Health. Every day, meron doon latest data kami about the COVID situation of the country. So I hope this could help. Thank you.
Okay.
Mags?
So Engineer,
Mags?
yes sir, sir, ano
Mags,
lang, i-confirm ko lang kay Engineer Anarna, Mayor Hab, and then I'll give this to you. I'll give the floor to you. So Engineer Anarna, we will expect a response from DOH, no, in relation to these questions po later. Tapos ma'am, pakidagdag na lang po yung tanong po ng Mindanao Today, kasing pareho lang naman, sabi po ng Mindanao Today, how would the Health Department describe the COVID-19 response of Mindanao so far as a whole? No? So that's another question we're asking DOH. No? Yes, Mayor Oka, you had something.
Alipay ko, si Pat had a question. Pat, kumusta diha? We were together in the 11th Congress. Markada ko na si Pat, Mags. No? What we did, katong sa Bayanihan Fund, 1 month era sa LGU, sa cities, akong gibuhat was, I allocated mga almost 200 million. We constructed a SERID facility. No? Parang initially, TTMF siya on a 2.5 hectare property of the city. Pero ang ginawa ko, I donated the land and the building to Northern Mindanao Medical Center. Bigla nga sila, why are you donating this? Dahil alam ko kasi, number one, short sila sa space. Prohibitive na ang cost sa expansion. They have to build vertically, no? And mahal na. Pangalawa, sikip. So, sabi ko, use this as a TTMF, pero i-donate ko na sa NMMC. Pero I want you to understand na ang long-term vision ko nito, duha. One is we wish na ito ay magiging version ng RITM in Mindanao. Yung Research Institute of Tropical Medicine, no? Yung kung saan yung RT-PCR pinapadala yung mga swab natin noon, nung una. Wala kasing RITM dito sa Mindanao. So sana, if we can use this long term as our own version of RITM. Pangalawa, our own version as well of San Lazaro Hospital, no? Specializing in infectious diseases. Now, doon sa bakuna, alam mo, nung umpisa kasi napansin ko na patingi-tingi ang delivery. Mahirap, hindi biro ang problema ni Secretary Galvez. I could understand it. Ang hirap mag-procure, no? Ang hirap mag-procure, lalo na yung mga ibang bansa. Siyempre, pressured sila sa kanilang mga sariling countries na yung manufacture nila should first be made available to their own citizens, no? So what I did was nakiusap ako. I wrote a letter to Secretary Galvez and told him na we have prepared sa aming mga simulation, we have vaccination teams, and we are ready, willing, and able, and committed, no? And alam namin na ang mission mo is to protect the people. And kami rin are willing and committed to be used. Sabi ko, so nakiusap ako, use us. Gamitin mo kami. Dahil ang nangyari kasi sa Metro Manila, kitang-kita na nirelax nila yung restrictive guidelines nila, no? And also because of ang private sector sa Manila had also procured vaccines on their own, no? So napansin ko ang DOH medyo could not be as strict in Manila as they have been outside of Metro Manila. Naintindihan ko rin naman bakit stricto sila dahil may kondisyon yan yung COVAX. Nagbibigay yung ibang bansa ng bakuna pero dapat may priority talaga system, no? I understood that, pero sabi ko nga sa DOH dito na kaya nakiusap ako, can you give us the vaccines directly, and we will still be supervised by our regional office and we will still be monitored by them, pero I need to plan at least one week in advance, no? Buti naman pumayag si Secretary Galvez, no? Kaya ngayon ang nangyari, Metro Manila, NCR Plus, and then yung mga key cities, Cebu, Davao, and then yung 8. I think sa Mindanao kasama Jensan, Zamboanga, and Cagayan de Oro. So, sa awa ng Diyos, we're okay. Ang importante lang is, yun nga, we'll just have to we show results. Dahil tinitingnan din naman nila sa Manila, tinitingnan nila ang delivery, ang rollout sa local eh. Kung makita nila na magaling ang rollout mo, they will add more vaccines. They will certainly do that. Pero kung walang mangyayari, don't expect na dagdagan nila ang bakuna natin. So ano yan, very simple lang. Just show results and I'm sure Secretary Galvez will respond accordingly. Salamat, Max.
Salamat, Mayor. So we're looking forward to the response of DOH, pero nindot tong pagpaambit ni Mayor, so we have a concrete sense of the response, no? Speaking to the questions about vaccination in particular. Okay, next slide, palihog. I think this is a question for NCIP. Aubrey, please, next slide. So mukhang for Director Serna po ito. Dr. Serna, could you explain the context of the term negative, no, that you use to refer to traditional practices in relation to COVID-19? At I think the context, yung pinanggalingan ng tanong na yan ay, shouldn't the implementation of health protocols be contextualized? And therefore, why would we call something negative? No? So yeah, go ahead, okay, Director Serna.
Thank you very much, Mags. May I also acknowledge my fellow NCIPian here, Dr. Cachola, who is, I believe, is also expert in answering the query. May I ask that she would be recognized in order to give a detailed explanation to the presentation.
Secretariat, could you unmute Ma'am Cachola, please?
Thank you.
Go ahead po.
Yes, good morning po. Yeah. Yung pong context po ng term na negative that was used in the presentation was that we, the IPs, usually have traditional practices like we have a longer time that we parang naglalamay sa ating mga dead relatives in giving respect to them. So sometimes when maski yung cause sana ng death ng ating loved ones ay dahil ay COVID, may mga IP groups na they don't submit to the IATF guideline. So doon po napupunta yung context na nagiging negative po yung ating traditional practice since po nagkakaroon ng pagkalat ng COVID-19 po. Another po ay yung kung minsan din po may mga times na hindi tayo naniniwala, may mga IP groups na they refuse vaccination kasi sa kanila mas pinapahalagahan po nila yung kanilang traditional na practices. So doon po nagiging negative yung ating tradition po. Yun lang po. Thank you po.
Salamat po, Ma'am Cachola. Director Firdausi, I'll proceed to the next question na po, no? Director Serna, okay po. Okay, next question. I think this is for Secretary, please. Kayo po uli, Mayor Oka. Na-trigger lang po yata nung inyong pagbabahagi sa typhoon, no? So, ano daw po ba yung disaster risk management mechanisms ng Cagayan de Oro after Sendong? So,
Well,
Mayor Oka?
yeah, Mags, number one, yung I organized the City Disaster Risk Reduction Department, no? And dati kasi volunteer group lang yan. And syempre, yung mga ganun, kahit yung mga volunteers, binaha na rin eh. So, to each his own na, no? And we really allocated funding to really equip and capacitate our team. You know, when I organized the department, bagong pasok ako sa City Hall noon, ni-recruit ko yung basketball team ko. Ni-recruit ko. I was criticized dahil bakit daw mga basketball players ang kinuha ko. Mags, mga kondisyon yung mga yan eh. Kaya, yun, trinain natin sa yung mga different modalities. I would attribute the development sa ating disaster preparedness kay Colonel Monsanto. Siya ang architect dyan ng 911 sa Davao, no? And at that time kasi he joined Cagayan de Oro for that. I think now he's back in Malacanang, no? Pero for more than 7 years siya ang nag-asikaso. And kaya marami tayong, in fact, lahat ng ambulansya, halos lahat, except for 1 or 2 lang, no, na iniwan sa hospital. Pero ang lahat ng ambulansya nasa disaster risk reduction team na sila mag-respond. Ito ngayon, malaki ang role ng City Disaster Risk Reduction. Yung mga extraction ng mga high-risk close contact, extraction ng mga positives, yung bagong result ng RT-PCR test, no? And lahat na yan, sila ang nag-aasikaso. Yung ating granular lockdowns last year, no? We started that last year dahil ayaw kong mag-impose ng lockdown in the entire city, no? So it worked ngayon, ang challenge ko is how can we share the expertise and yung capacity ng ating city risk reduction team to the rest of the province and the region, no? So nagle-lecture na sila on many yung USAR, immediate quick response, etc. No? We're very, very happy. And sa awa ng Diyos, yung merong bagyo na dumating sa Cagayan de Oro, similar to what to Sendong, no? Pero sa awa ng Diyos, there was no casualty. Sa awa ng Diyos. Max.
Salamat po, Mayor. We have a question from, did you show it? It's for DOH. I'm not sure kung it's the one on water. Okay. Aubrey, can you refresh because I moved the question of Ms. Amina Sana. Is that the newest? Okay. See the question for, yeah, kailangan na i-refresh. Yung tanong po natin sa DOH, Ma'am Anarna, ano po ba, meron po bang current data ang DOH sa access to potable water in rural Mindanao compared to the other regions of the country? Tapos po, yun. Teka, let me just finish that. May pagbabago daw po ba? Okay. Yung tungkol po sa inefficiencies in the system, ililipat lang po natin because there's another slide that's actually related to that po. So ito lang po muna from Sir Caloy.
Hello, ma'am. Do I need to respond na?
Yes, so go
Hello.
ahead.
Okay. For the DOH data on access to potable water, we have data from the Field Health Service Information System, which is open for the public, or the FHSIS of the Department of Health. The latest one that we have is 2000. So in that data, you can see that there are two types of data there. The first one is the regional data as to region, number of household with access to basic water supply services. And another column, if you will browse that data, versus the per region with access to safely managed drinking water services. Mapapansin nyo dun sa basic water services, in the year 2020, na ang taas nila. For example, in Region 9, the basic access to water supply services, we have 72% in 2020. Pero pagdating ng safely managed, kasi bago yan, kung napapansin nyo yung safely managed, ito yung sa SDG number 6, Sustainable Development Goal. Kung sa basic water services, meron ka lang access sa tubig, naglakad ka ng 30 minutes, kinakount na yon, pabalik, papunta at pabalik. Meron kang access to level 1, level 2, level 3, so kinakount na yon. Pero sa safely managed kasi, you have to meet the 3 criteria. Number 1, may access ka. Yung basic water sources mo located on the premises. So, ibig sabihin, nandun mismo sa, katulad that you are enjoying, nasa top mo or nandun sa loob ng perimeter fence mo. So, dapat mamimit mo yung criteria na yan. Yung number 2, available when needed. Halimbawa, pagising mo ng alas 10 ng gabi, kailangan mo ng tubig, nandun siya. So, yung number 3, dapat merong examination na ginagawa, free from fecal coliform and other priority chemical contamination na nakasaad doon sa Philippine National Standards for Drinking Water. So 3 criteria yon. Kaya minsan nagko-comply ka sa isa, hindi ka naman makakomply sa pangalawa or pangatlo. So you are not counted as safely managed drinking water services. Pero we have to face the reality na ito na talaga yung in ngayon kasi we have to meet the SDG 6 on clean water. So we have a data there on Region 9, 10, 11, 12, BARM, and Caraga, and I have it also in my hand. So example, in Region 10, nandito si Mayor, nung basic pa, ang data nyo ng basic access is ang taas na, 95%. Pero when measure mo yung 3 criteria na safely managed drinking water services, naging 74% na lang. Di ba? So that's how the water services data we have in the Philippines. Thank you.
Thank you, ma'am. We have one question for NCIP. Bahala na po si Director Serna or si Ms. De Silva kung sino sa kanila ang sasagot. Ang tanong po ay, siyempre, alam nating lahat, sa ancestral domain ay sentro sa usapin ng IP rights, no? So, ilan na po daw ba yung porsyento ng ancestral domain claims in Mindanao na naghihintay pa ng issuance ng CADPs, no? And then related to that is the question, sa inyo po bang pagtingin sa trends, nag-improve daw po ba yung issuance of CADPs since IPRA was passed 25 years ago? So, Director Serna or Ms. De Silva, please.
Okay, thank you once again, and thank you din po sa nagtanong. With regards to the questions, how many % of ancestral domain claims in Mindanao still await the issuance of CADPs? My apologies, but I don't have the exact figure as well as the exact percentage because this matter is within the realm of ancestral domains office. I am representing the Office of Education, Culture, and Health. At any rate, medyo sa under po ng lideratura po ni Colonel Alan Capuyan, Secretary Alan Capuyan, medyo tumaas po ang percentage ng nabibigyan po ng ating mga CADP sa Mindanao. Ang isa lang do sa medyo nakakalungkot ay while CADPs were given, ang problema po doon ay yung pagpaparehistro sa mga CADP na po doon sa LRA. So, yan po ang problema. So far, as to percentage, if I'm not mistaken, were, I think, more than 50% as far as Mindanao is concerned. Sa nabigyan po ng CADTI as well as na proseso po ng mga CADTI areas. Thank you.
Thank you po, Director Sorna. Ma'am De Silva, anything that you might want to add po at this point?
Yes, ma'am. Actually, I'm calling already the office that is concerned on the percentage of katiyables and because meron po kasing latest na survey ng mga medical officers namin. Kaso talaga po I have to admit yan. Hindi po namin memoryado ni Director.
Okay, sige po.
Rest assured that itong administration po, napakarami po talaga activities at nagawa ang NCIP na magsasaludo po kami na nagtagal dyan. Salamat po.
Salamat po. So, Director Sorna, Ma'am De Silva, if you can get that information po, please share with the Secretariat ng conference para po maibahagi rin po sa iba nating mga participants. No? So,
Okay,
thank you po.
yes, ma'am. Mags, we will. Thank you.
Okay, thank you po. Ma'am De Silva, sabi nung mga nagchat, nag-call a friend ng NCIP. At tama po yan, no? Because if you don't have the information available, we should really ask and then call a friend. So thank you for doing that.
Yeah. It's very hard to fabricate stories. So
Yes,
we
po.
should.
Yes, po.
Thank you for
Tama po.
authentication and everything. So mahirap po mag-DDTO lalo na sa mga katutubo nating kapatid. Salamat po.
Opo. Thank you po. Meron pong, it's 11:05 and actually medyo nag-overtime na tayo kasi exciting itong ating topic, no? So, ang gagawin ko na lang po, with the permission of everyone, can I just read aloud the questions that we would like to request our panelists to respond to, pero ang magiging request lang po natin ay pwede po bang ang inyong sagot ay ibigay niyo lang po sa Secretariat kasi we will find ways of getting them to the participants. Meaning, hindi na po natin sasagutin dito ngayon, but later na lang po, no? So, halimbawa po, for Engineer Anarna, marami po kasing tanong na naman in relation to the pandemic, no? For example, ano daw, no? Sabi ng Tractacos, can DOH through National IATF have a uniform travel requirement, no? And lower the RT-PCR fees kasi mahal nga naman, no? Mukhang government is making travel difficult with the burdensome S-Pass, no? People with emergency health conditions cannot travel immediately, even with negative results, as S-Pass application is still pending due to poor connectivity, no? Sabi naman ni Ma'am Amina Rasul Bernardo, has DOH addressed the inefficiencies in the system to combat the pandemic? And ito, tanong uli ng Tractacos ni Ma'am Arlene Sevilla, ang vaccination for elementary pupils daw ba ay being considered by DOH for the next school year 2020, for annual, I guess this is calendar year 2021-2022, no? As there are too many children not enrolled, especially those in far-flung and areas and outskirt communities whose parents are not able to read and write, and therefore they cannot help their children understand the modules that they're working on. So again, i-share natin sa DOH and hopefully DOH will respond, no? Afterwards. Meron pong tanong po for mga katanungan, ayan na yun. And for Mayor Oka, next slide. Next slide. The Mayor, ito ay mukhang grupo na very impressed, no, sa ginagawa ng Cagayan de Oro. So Mayor, we don't have time na, pero may interesado po talaga sa inyong best strategies to minimize some science-based problems. And please emphasize daw air quality management, improvement of land use, and transport master plan, no? So hingin na lang po namin ang sagot niyo, Mayor, para po mapabahagi natin sa mga participants. Okay lang po, Mayor?
Yeah, I cannot hear you.
Ay, Mayor, hindi niyo po ako marinig. Mayor, ano
Max?
na lang po? Yes po. Can people hear me? Or ano lang?
Yes,
Secretary?
I'm
Yes.
sorry,
Okay,
Max, I cannot
so,
hear you.
We can
Okay.
hear both of you.
Can I
We can
speak
hear
now?
both of you.
okay. Mayor, we
Hello?
don't have time na, Mayor Oka,
Mags?
don't have, we can hear you po. Madunggan ka na mo. Ayan. Sige, he's wearing his earbuds na.
Yeah, sorry.
Mayor, oo,
Sorry.
oo.
Sorry.
Sige.
Yeah.
Mayor, kanang I was explaining, medyo naglapas naman ko sa oras. And
Ako lagi,
sila ba
lagi.
workshop, no? Kay
Oo.
grabe
Oo.
man ang discussion. So ang request lang namo, Mayor, is we're sharing this question that's addressed to you. Tapos
Oo.
kuhaon lang namo ang inyong response
Oo.
so that we can share it to the participants. Pero dili
Oo.
na lang nato tubagon karon. If that's okay po,
Oo.
Mayor.
Okay lang, pero dali na CLUP, Comprehensive Land Use Plan. Awardee
Okay.
kita sa sa DSUD for
Okay.
our climate change adaptive and disaster risk reduction adaptive as well, no? CLUP. And last week we received the award from the DSUD
Oh.
Secretary Del Rosario. Salamat, Mark.
Okay, thank you,
Ah.
Mayor. So we'll just probably